Hi everyone, this is Albert.khait here, and welcome to this presentation. Today we will be talking about Pediatrics for McGill nursing students, a proposed interprofessional approach to learning. So, two of my great professional interests are the promotion of patient-centered care, as well as searching for a new and better way of working within an interdisciplinary team. Surprisingly, the collaboration between physicians and nurses is still an underutilized area of healthcare, especially when it comes to meeting the educational needs of trainees of the up-and-coming generation. So, the issue that I've chosen to address is to help undergraduate nursing students to perform sound physical assessments in my area of specialty, which is pediatrics. Now, what's interesting is that historically, the physical assessment was not part of a nurse's scope of practice. But, in the last 20 years, the role of a nurse has changed considerably. I would like to concurrently focus on two classes of students taking the Health and Physical Assessment course at the Ingram School of Nursing at McGill. They are the students who are part of the Bachelor of Science of Nursing class and the Bachelor of Nursing Integrated class. Each group consists of a class size roughly of 100 people. So, right now, before we begin, I would like to make the important point that the ability, availability, and scope of practice of a nurse actually affects everyone, not just the healthcare workers and educators, but patients, families, and society as a whole. So, currently at McGill, the students from both classes actually don't have a practical lab session in pediatrics in the same way that they do for adult medicine. As such, I would like to design and implement this additional component. Presently, although the students get a certain degree of integrated content, the dedicated content is not significant despite the demand. For instance, one of the visiting lecturers for the B&I class is a pediatric emergentologist, but even though he is able to deliver a didactic component, he is currently unavailable to help coordinate a lab session for the students. How would an ideal situation work? To begin with, the current curriculum is only beginning to integrate problem-based learning scenarios and other modalities that have high satisfaction rating among students from other healthcare professions and other nursing schools. Furthermore, other nursing schools have successfully used a combination of role-playing clinical vignettes, and in our case, we have actually had volunteers offer to bring their children into the learning environment for demonstrative purposes, but this has never been implemented in the past. On the more technical side, some institutions are actually using high-fidelity simulation models such as SimMan and SimBaby in their educational scenarios for nursing students. Furthermore, they're also using virtual patients, which are computer case simulations. And for our approach, we would like to use Prezi.com, which is a cloud-based presentation software and storytelling tool for presenting ideas on a virtual canvas. We have created a sample Prezi for the pilot teaching project, which you may view. Prezi is a new, innovative, cloud-based presentation software and storytelling tool which goes above and beyond what PowerPoint and even the highly acclaimed Keynote are capable of. Afterwards, we will have a practical lab session with 4 interactive modules. These are proposed: neonatal, adolescent, respiratory, and ethics. Now, the vast majority of the B&I class, for instance, that I polled, is currently working, 79%. And anecdotally, according to their instructors, they are in high demand of hands-on education. And one factor to keep in mind that we should be mindful of is to not oversaturate the students with content. And we also need to make sure that the lab is held on a convenient day. Unfortunately, for the pilot lab, we held it on a day where they had to take an organic chemistry midterm, which was written in the evening. As it turns out, we were able to coordinate this pilot project that involved the B&I class, and I was able to find out about some of their learning preferences, which we did via a SurveyMonkey poll. These results will be shown at the end of the presentation. Now, another way to gauge the student needs is via the School of Nursing Student Senate representative. I have already contacted her, and she has the individual class reps on alert to possibly distribute further surveys if the teaching team would like them to. So the other stakeholders are the instructors and the teaching assistants who are a part of our teaching team. I anonymously surveyed our teaching team after the pilot project, and I will show you the results at the end as well. Incidentally, the financial reimbursement for teachers, particularly TAs, is not very significant, and so a lot of the work that they put in was actually voluntary. The goal of the project is for nursing students to develop their fundamental knowledge, attitudes, and skills necessary to perform a certain select set of 4 high-yield aspects of the PEDS health and physical assessment. And this is so they could better prepare for their pediatric clinical rotation. Nursing students have access to a recently renovated learning laboratory. The lab has 7 clinical beds, an ICU bed, a stretcher, an exam table, and teleconference abilities. Here, students practice doing the general physical assessment, but they also have access to equipment to do well checks, a sim limb for starting IVs, and they can also practice drawing fake blood from a central line. Another resource that should be available to students is the Sim Center, which is one of the most modern facilities of its kind in Canada. But once again, since it is a shared resource, realistically, access is limited. So there will be 3 groups of 34 students participating in the lab sessions per class. Each group will have 2.5 hours of protected learning time within the lab. As previously mentioned, there will be 4 modules in the curriculum. I will discuss each of them in order. So for the neonatal lab, you guys will remember the APGAR scoring system from school. So by the end of the lab session, each student will have been able to successfully identify in writing the 5 individual categorical components of the APGAR scoring system, and to clearly identify and distinguish features between a score of 0, 1, and 2 within each of these categories. We will recommend that the students demonstrate this knowledge in the form of a table. So for the class, by the end of the lab session, at least 90% of the students will have been able to successfully name 5 of the components, as well as 80% of them will be able to clearly identify distinguishing features between a score of 0, 1, and 2 within each of these categories. So first, in the Prezi, there will be a very brief online video lecture recorded by one of the team members, which will introduce the highlighted significance of the APGAR scoring system. The lecture will also include a mnemonic or memory to help the students score the individual components of the APGAR. Now, with regards to the adolescent module, the goals will be psychomotor, and you might remember this assessment from school as well. As such, so by the end of the lab session, each student will demonstrate via verbalization their use of the HEADS assessment and its 5 specific elements, or at least 5 of these particular elements, in a simulation role-playing scenario which will be supervised by a TA or instructor. The objective for the entire class is that by the end of the lab session, at least 80% of the students will have verbalized at least 5 of these screening elements. So we will have an online reading via summary sheet, and it will be available on Google Docs. Likewise, there will be an online mini introduction with a soundbite recorded by a team member as part of the Prezi component. There will be a simulated role-playing scenario which will be supervised. Students will get a chance to practice amongst themselves, and they'll get immediate and specific feedback. Now, for the respiratory system, the learner objectives will be cognitive, whereby by the end of the lab session, each individual student will be capable of verbalizing the 3 systematic steps of analyzing a simulated patient for respiratory distress: inspection, percussion, and auscultation. Furthermore, for the group of students who are training, by the end of the specific lab session, at least 80% of them will be capable of verbalizing all 3 steps. Once again, there will be a very brief online video lecture plus a narrated YouTube demonstration of how one should perform the assessment. At the end of the online component, we'll also have an online quiz to take, and we'll also bring in a series of volunteer child actors. For the ethics objectives, one proposed sim case is that of a 17-year-old boy who is a Jehovah's Witness and he has leukemia. He may or may not want life-saving measures in the form of a blood transfusion. As such, the learner's objectives will be effective. The objective is that by the end of the lab session, each student will have verbally identified to the group his or her unique attitudes and beliefs regarding adolescence and their ability to consent. Likewise, they will have discussed with their classmates and instructors how these might influence their abilities to advocate for their patient. So for the group, our goal will be that 90% of them will have identified their beliefs and completed this discussion. There will be an online lecture and introduction which we have recorded, as well as some YouTube links of short clips that include actual legal ethical situations. Students will reflect aloud on their perceived ability to adjust to those of their patients. We will also pose some open-ended questions for discussion, such as, how does one advocate for their patients on their behalf? The facilitator for this session should also step in at some point to share his or her own personal experiences and discuss how their views have changed over time. Specific feedback will be immediately provided. How will this be implemented? If down the line we actually decide to turn this teaching project into a scholarly improvement project and consider publication, there may be some considerations. That's only if we decide to take the step. In that case, we'd have to approach the REB at McGill. And according to McGill policy, the ethical conduct of research, including human subjects, quality assurance studies, performance reviews, or testing within normal educational requirements, such as our project, are not subject to REB review. Hence, the REB may grant us an exemption. Now, the TAs and instructors regularly take part in weekly labs. And as such, it was logical to plan and launch a pilot project, which we did earlier this month. All of us assisted with the practical lab component and made direct observations. The actual final project will be hopefully launched in its entirety in January. To evaluate feedback on how well this curriculum is doing, there will be a first question set. It will pertain to soliciting feedback from the learners in the form of qualitative data. How organized, engaging, well-delivered, and useful do the learners believe that the curriculum's online component, small group discussions, role-playing activity, simulated patients, patient demonstrations, and other lab activities are? The first question can be most appropriately evaluated via post-test only. The second evaluation set, which is about 4 questions, will help solicit quantitative data. And it'll help show us if we succeeded at meeting endpoint objectives. So number 1, by the end of the lab session, what percentage of students were able to successfully list the 5 individual categorical components of the APGAR scoring system and clearly identify in writing the distinguishing features between a score of 0, 1, and 2 within each of these categories? Number 2, what percentage of students were able to successfully verbalize at least 5 of the screening elements from the HEADS assessment? Number 3, with regards to the respiratory distress module, what percentage of students were able to successfully verbalize all 3 individual steps? Number 4, with regards to the ethics scenario, what percentage of the students will have identified his or her unique attitudes and beliefs and discussed them with the classmates and instructors? And likewise, this can also be evaluated via post-test only. So how will we evaluate? SurveyMonkey is a free online survey tool which can allow you to post up to 10 questions. To increase the response rate, it can be done in class. In the end, you actually get a great visual breakdown of the results. So for the pilot project, I was able to obtain a post-test with a respondence rate of 51%, 52 out of 102 for the class. It was so-so in terms of response rate, but the results we got were pretty positive. So likewise, I polled our own team, and 4 out of 6 of them have responded so far. I will provide you a breakdown. So the result of the pilot modules. This is just for our own educational purposes. So there was pretty positive feedback. So the students did feel that the scenarios helped them in their daily practice as a nurse. Likewise, they felt that we were pretty well organized, and they felt that we were concerned about their learning. They felt that we helped them develop their critical thinking skills, and they also felt, they agreed that they would be better able to approach a child in the future. Some comments that they wrote were that they enjoyed the Prezi, they liked discussing CF with me, which made me feel pretty good, and they felt that I was approachable. So that was really the goal. They enjoyed working with the kids, but they didn't like the timing of the lab. Not sure if that could have been helped. They would have liked seeing the Prezi earlier, and they also liked Rosetta Station especially. For the teacher survey, I didn't take the survey myself, but we also had some positive feedback from the people involved. They also felt that we were organized, so we were in agreement with the students. They actually really liked the Prezi. They want to maybe design something like that in the future themselves. And they also felt that I was responsive to their needs as a fellow teacher, and that was also one of my major goals. So the material that we covered was applicable. They felt that we support each other as a team, which is also pretty good, also one of the major goals. And the collaboration improved their own knowledge of pediatrics. Student engagement was high, very high rather. And some written comments were that the lab was a pleasure, they enjoyed working together, the students enjoyed the lab as well. And another note is that advanced planning would be appreciated, and the kids were also appreciated. So in the end, I would like to conclude that one of the unique strengths of this project is that as a team, we actually have the unique ability to build a shared vision. So together we have the potential to trigger a reflective process before the teachers and students even meet. We hope to accomplish this by creating 4 high-quality learning modules with a strong and effective online component. In the end, we would have succeeded in flipping the classroom and helping the students do a significant portion of the learning at home. Thus, the stage would have been set for the learners to be in the right frame of mind, and they could come together with us to collaborate as an interprofessional team. We'd be there to meet their needs. So, most importantly, the emphasis would have been shifted from the teacher to the student. And furthermore, we would have actually role modeled for the students how nurses and physicians can work effectively together to create a positive and effective learning and working environment. So that's it for now, folks, and thanks for listening. I hope you enjoyed the presentation. I now invite you to submit your feedback, questions, comments, and suggestions. Take care.